Welcome. Today we're diving into a rare and fascinating anomaly of the urinary system, bladder duplication. This condition, also known as double bladder, is characterized by the presence of two bladders instead of the usual one. Join us as we explore the causes, symptoms, diagnosis, and treatment options for this unusual condition. The exact cause of bladder duplication remains largely unknown, but it's believed to be a congenital condition. This means it arises during fetal development. Genetic factors, errors in the development of the urogenital sinus, which is the precursor to the bladder, and environmental influences during pregnancy may all play a role. Research is still ongoing to pinpoint the specific mechanisms that lead to this developmental abnormality. Bladder duplication occurs during the embryological development of the urinary system. Normally, the urogenital sinus divides to form the urethra and the bladder. In bladder duplication, this process goes awry. The urogenital sinus either partially or completely divides, resulting in two separate bladders. These bladders can vary significantly in size, shape, and their connections to the urethra. They might share a common connection, each have their own ureteral openings from the kidneys, or display variations in their muscular layers and nerve supply. These structural differences contribute to the range of symptoms and potential complications. Bladder duplication is an exceptionally rare condition. Accurate epidemiological data is challenging to obtain due to its infrequent occurrence and the possibility of asymptomatic cases that go undiagnosed. It is reported more often in children and is often discovered during investigations for other urological issues. There is no known gender or racial predilection. The signs and symptoms of bladder duplication can vary greatly depending on the type and severity of the duplication. Some individuals may remain asymptomatic throughout their lives. However, common symptoms include recurrent urinary tract infections, UTIs, urinary incontinence or leakage, difficulty emptying the bladder completely, frequent urination, abdominal pain or discomfort, and in some cases, the presence of a palpable mass in the lower abdomen. If both bladders drain effectively, the individual might present with polyuria, excessive urination. Early recognition of these symptoms is crucial for prompt diagnosis and intervention. Diagnosing bladder duplication typically involves a combination of imaging techniques. Ultrasound is often the initial imaging modality used, but more detailed imaging is usually required. Avoiding cystoarthrogram (VCUG), which uses X-rays to visualize the bladder and urethra during urination, can reveal the presence of two bladders and any associated vesicoureteral reflux. Magnetic resonance imaging (MRI) or computed tomography as CT scans provide detailed anatomical information about the bladders, ureters, and surrounding structures. Cystoscopy, where a small camera is inserted into the bladder, allows for direct visualization and assessment of the bladder lining. The specific diagnostic approach depends on the individual's clinical presentation and the findings from initial investigations. Bladder duplication can be classified based on the degree of separation and the anatomical arrangement of the two bladders. Some classifications include a complete duplication, where two fully formed bladders are present, partial duplication, where the bladders are connected by a septum, and hourglass bladder, a rare variation where the bladder is constricted in the middle, resembling an hourglass shape. Additionally, the arrangement of the ureters entering the bladders can vary, further contributing to the complexity of the classification. Treatment for bladder duplication depends largely on the severity of the symptoms and the presence of complications. Asymptomatic individuals may not require any treatment but will benefit from routine checkups. Symptomatic patients may benefit from antibiotics for recurrent UTIs. Surgical intervention may be necessary to correct anatomical abnormalities, relieve obstruction, or prevent further complications. Surgical options range from bladder reconstruction and reimplantation of the ureters to, in rare cases, removal of one of the bladders. The specific surgical approach is tailored to the individual's unique anatomy and clinical situation. Currently, there are no known preventative measures for bladder duplication, given that it is a congenital condition thought to arise from developmental errors early in pregnancy. Genetic counseling may be considered for families with congenital urological abnormalities. Promoting overall maternal health during pregnancy, including avoiding known teratogens as substances that can cause birth defects, may help minimize the risk of congenital anomalies, though a direct link to bladder duplication is not established. The prognosis for individuals with bladder duplication varies depending on the type and severity of the condition. Many individuals can lead relatively normal lives with appropriate management. However, potential complications, such as recurrent UTIs, urinary incontinence, and kidney damage, can impact long-term outcomes. Recent research is focused on improving diagnostic imaging techniques and refining surgical approaches to minimize complications. Advanced imaging and minimally invasive surgical techniques are also promising advancements. Continued research is essential to improve our understanding of the underlying causes and to develop more effective treatments for this rare condition.